starting off with the best subspecialty, which is pediatric emergency medicine. We have the honor of having one of my work colleagues currently, Kene Maduemem. He is currently a pediatric emergency trainee at Birmingham Children's Hospital. Kene is a Nigerian IMG who has graduated from university in Nigeria and has worked in Nigeria as well as many parts of the UK. He brings with him a wealth of experience and he is always very helpful. So over to Kene now.
And you're very kind. I'm not sure about wealth of experience, but anyway. And I'll try to share my screen. But as I'm sharing my screen, I would like to thank Kunal and Alex. I learned a lot from Kunal's talk, and Alex is my good friend, and I would say her prep notebook for grade was very helpful to me. So you can bother Alex if you're interested in PEM. I'm trying to, yeah. Can you see my screen?
Looks good.
Yeah, good. So I will time myself because usually I get feedbacks, Kenneth talks so fast. So I think this will be useful because I have 10 minutes, just whistle through the slides. Hopefully I won't be too fast for people not to understand me. My name is Kene. I'm one of the PEM grade trainees in my second year grade training in at Birmingham Children's Hospital, currently doing my 13th rotation. That's my time and now. So I'll try to go through this, describing my journey and just a bit of what PEM is all about, and just talk about this PEM, the right subspecialty for you, getting into PEM and my top tips, and then summarize. I acknowledge that this is a very extremely varied audience, so I'm trying to make it as useful as possible for everybody, and wearing the hat of an international medical graduate and understanding the challenges we face when we come into a new country with a new system. So my journey, I'm from somewhere in West of Africa, Nigeria. Definitely I'm here with you guys in the UK. So my journey started in Nigeria about 6 years ago actually. I first of all landed in Ireland, and I worked in Ireland for about 2 years and couldn't get a training number because of some issues I wouldn't want to get into. Eventually found myself in the UK and got a training number in the UK. So I really have, gone around, and as well as other people that may have actually traveled more than me. So I tend to understand what international medical graduates face from the African perspective, and also clinical and non-clinical challenges and barriers you may face when you come into a new system, a new country, and with lots of expectations and a bit of bias as well. So PEM is a relatively new subspecialty. Alex will bear witness that. The 2-year training, you can start from SC6 or 7. Thankfully, training is offered in every region in England. So you get to rank as much as you can, depending on family circumstances and personal reasons. And there are 2 training sites in Scotland, if I'm not mistaken, and there's 1 each in Wales and Northern Ireland. So there's no SPIN available. SPIN is a special interest, which can be a year or 18 months. A lot of other subspecialties actually offer SPIN for those that may not have been successful with grade. So, but PEM doesn't really offer that at the moment. And there are 2 routes to enter pediatric emergency medicine. So most of us here would have been through the RCPCH route, but there is the ROChem, which is Royal College of Emergency Medicine, where they come and do 1 year of pediatric emergency medicine, and they come out as emergency medicine with pediatric emergency medicine subspecialty. So being a migrant is a massive deal, especially when you're striving so hard to excel in your career or in any career. So thinking about PEM being your right subspecialty is a very tricky question to answer. I can't answer that, but what I can tell you is that it's mostly about you, if not all about you. So it depends on who you are and what you want to do. It's somewhat skill specific, having been a general pediatric registrar for several years and being an ED registrar, very different. There are lots of things that will be tested. You'll be tried and tested. Your leadership skill will be tested and tried so much. Your resilience and your multitasking ability will be tried so much. You really don't have the luxury of sitting on patients. You really don't have the luxury of having pizza, which I miss in Gen Peds. But you are able to work with a broader MDT with limited time, which means that for you to be able to demonstrate a lot of competencies in PEM, it's not that hard, compared to other subspecialties, which are very specialized. So I brought out the last point about key performance indicators because we as international medical graduates, I have to say this because it's really important for me to be blunt and truthful about it. The system would want to favor those that are very fast. So you really have to be fast. For example, if you're really doing a PEM subspecialty, you have to be fast in making your decisions. You have to be fast in everything. You have to talk fast, unfortunately, but people still complain that he talks very fast. So key performance indicators is quite hot in ED. I've had pediatric clinicians, my friends, who say that they can't really cope with the 4-hour target. They want to take their time. So these are the questions sometimes you ask yourself before you choose PEM. Some people are lucky actually to get a PEM, a pediatric job that involves a tertiary ED job in their level 1 training, and that actually gives you a bit of flavor to whether this is what you want, or but sometimes it's really very important for you to think about that. But when you decide that you want to do pediatric emergency medicine, I think thankfully I might be biased, but it's one of the subspecialties where it's quite not terribly hard to demonstrate your commitment to PEM, because you can do that even home here or abroad. So you would have done a lot of things related to acute pediatrics or pediatric emergency care, not just in the UK, but abroad. And you can evidence those things. But how do you evidence that matters? And that's why Kunal stuff is very important. So if you're fortunate enough to be your ST1, ST2, then you have a while to actually get your journey a lot smoother than if you're ST4, ST5 and realizing you need PEM. That means you have more work to do. So getting a mentor may be helpful. I know as IMGs, we are very humble. We're used to calling people sir, because that's the way it is back home. Or here, you don't have to be shy. You have to stick to what you want. You know what you want and go for it. So getting a mentor, it doesn't matter who, or who you feel comfortable, the person can guide and nurture you. And PEM is definitely not for certain people of certain background. Obviously, it might look like pediatric emergency medicine is white dominating. That is true, but still doesn't mean that even if you're black or orange or purple, if you want to do PEM, you stick your head and you go for it and you will get it. And don't feel uncomfortable speaking to colleagues. We feel uncomfortable. We want to hang out with Black people, for example. But I think we should be open-minded and speak to lots of colleagues about experiences, because you don't know really what you hear, where you hear them. That's going to help you in this journey. So my top tips: be yourself. I'm always talking about be yourself. Be yourself. Don't be robotic. Be yourself. You don't know, you don't know. Even in the interview, be yourself. It's about you. I remember Damian Roland telling me during the interview, perhaps, and this is your show. It's about you. And don't sell yourself short. I was so pleased when Kunal said that. Don't sell yourself short. We as IMGs might actually be more likely to allow our excessive modesty take advantage of the so much hard work we've done abroad. No. Use I, it is you in the interview, but still acknowledge the strength of teamwork. It's really very important because you can't work alone. And I know some of us come from backgrounds in Africa and Asia where the doctor says something, everyone does it. It's different here, so it has to be a teamwork. So sometimes you have to realize that there are differences in culture, but we have to actually adapt to the way NHS works. And that would actually make things a lot smoother for you. Overall, whatever you put in your application, which I'm sure you have lots of people to help you with that, the panel needs to buy whatever you're selling. So you really need to pick up, you don't have to be quiet about it, because sometimes we go humble and quiet and not speak up, and it's perceived as being timid. That happens. So you need to speak up, strike a balance between being cocky and being modest, but still sell yourself that this is you and this is what you can do. Display your strength, but don't forget to highlight your vulnerabilities, because that makes you not just a good clinician, but it makes you a fine human being. So in summary, diversity is incredibly needed in NHS. So that means that whatever you want to do, go for it, strive hard, and you will get it. It's not meant for certain people, as may be perceived, but that's wrong. Bring out your abroad experience. The first research I did in Ireland was about oral rehydration therapy, because that's what we do in Nigeria. Healthcare is not free, so we don't necessarily have to put people on IV fluids because they have to pay for beds. I was really astonished and really worried that I have people, 15-year-olds, 13-year-olds, on IV fluids because of gastroenteritis. And I said, why wouldn't ORS work? And I had to do a research on that with parents. And that actually brought out your abroad experience. And NHS, they need your abroad experience. So be open-minded and adapt to NHS processes, because at the end of the day, you're working for NHS. You bring your abroad experience, but you adapt it and translate it back to NHS. You can do this. And finally, you have to actually create a niche for yourself. In my interview, I said I want to be a PEM consultant in a big DGH. I don't really want to be a fancy tertiary children's ED consultant, because I come from a country where there is little or nothing. So I want to actually use the available resources to actually provide optimal care. As you may know, the healthcare delivery in the UK is not equal. There are so many places that are really lacking essential healthcare, but being able to actually offer what you can with available means is really golden. So I think that is my last slide. So regardless of who you are, what you've been through, you can be what you want to be. That's my email address. If you want to drop me an email. I may not really be very fabulous at looking at your application, but I will help you to actually translate whatever you've come with from abroad, translate it to the UK and actually do more in the UK, and you will actually be valued and you get that job. Thank you.
Thank you very much, Kene. This